I mean, yeah, updates. If you got anything from this morning from the Just Walk meeting, if anything exciting happened there, go ahead and let us know.
Okay. Um, well, I wish I had the notes pulled up from this morning, but I know that for Children's Mercy, we have walks planned for two sites, one at Crown Center and one for Adele Hall. Our walks are now being more so organized by our Take Care Wellbeing program. So we're kind of more focused on our employees for these walks. I know that Stephanie had updates for the Southeast Community Center walks. Stephanie, do you want me to give updates on that, or would you mind?
No, I don't mind at all. So we're hosting our 34th walk this Saturday. And I have a really well-established group of walkers with the UMKC Wellness Committee. And we've also reestablished our contract not to partner, but to collaborate on walks with the AARP. And so that is well established at the Southeast Community Center. And then I'm working on Walk with the Doc on the Lakewood campus with the clerkship as well. So hopefully we'll rebirth that as an opportunity as well.
Cool.
Well, awesome. I think that's really all we had for Just Walk updates then. So our next item on the agenda is updates on our curriculum strategy. Um, I know when we last spoke, it was planning for the culinary grand rounds at KU. I have not heard anything back from Dr. Love, and I don't think she's sent anything over to anybody else unless it's been you, Jay, and I don't,
Nope.
that's what I thought. Okay. Well, I wish I had more to share because I know a lot of people were interested in that. So I apologize. I haven't heard anything back or anything related to it, even through Children's Mercy. So when I do find something out, I will update the group. I'm hoping sooner rather than later because I know that that's coming up. I think it is don't know why I want to say it's the 19th. Yeah,
Yeah, I think
18th
the
and
19th
19th,
and
I
20th,
think.
18th,
Okay.
19th, 19th, 20th.
Yeah.
Yeah, and if we have a flyer, our dean's office is interested in getting that out just so people can put it on their calendars.
I wish there was one. I've been trying to, yeah, follow up and find one for that too. And just, I don't think they've got one created yet. So
Okay.
Uh,
KU doing
what?
it?
it's through KU. Yeah.
Okay.
But I will have a separate session at Children's Mercy as well, which is typically open. And then we also record these grand round sessions. But I haven't heard anything Children's Mercy either.
Yeah, and the grand rounds is switching up, so it's not like a full everybody grand rounds kind of thing every time, as far as I understand. But I'm not 100% sure how that is supposed to work going forward. Yeah, yeah, it'd be nice to have. I mean, it's only a month away. It'd be nice to have some more info for everybody. But
I think maybe remind the whole group and just say, hey, can we get a flyer? We've got our mechanism to post it now. I don't know that if that'd be Julia Bonamini or like Brad Barth or something over at KU.
yeah, we'll
Yeah.
give that a shot. Julia knows
Yeah.
about it. She was at the last meeting, so she definitely heard about it and knows about it. But um, yeah, I don't know how involved she is with any of the grand rounds or scheduling or planning or anything. So
Yeah, I mean, even in our own shop, curriculum's just like it's not perfectly placed with us. And so the dean, when I met with him, he said, well, I have a dean series of sponsor grand rounds. So anything that doesn't really have a home, send it through me. And so he was kind enough to say, hey, I'll just make sure it gets out to all faculty and our affiliates and stuff. So we just need the flyer, but at least it's a great way as a dean series of lectures that he's sort of endorsing. That gives us a chance to really engage everyone in our affiliates. So yeah.
Oh
right, yeah,
yeah.
I mean, go ahead.
I was gonna say absolutely. I'll probably reach out to Marissa Love again as she's the one organizing the event, but I'll CC Julia. I didn't know who to include on, yeah, my follow-up emails, so I'll go ahead and do that and maybe we'll hear back from one of them.
Um, all right, yeah, then I think the next big thing on the agenda is the implementation project. So we got two fairly big ones, and Stephanie knows all about them. But yeah, I think if you just want to go over yours, and then we can do the second one, and just see what we think and see what we can add and or subtract or combine between all of them. So
Do you want me, Katie, I have no changes from what I sent you on Friday.
Oh yeah, absolutely. So give me 1 second. I think maybe we should discuss something about funding really quick before we
Yeah.
proceed with reviewing. So I know both applications are asking for funding from healthcare and public health. On that note, combined, we do not have enough to fund both projects fully. So I just want to let everyone be aware of that. We can give partial funding for each project, but we won't have enough to fund both fully. If they're approved through this sector and the core work group, that's the whole thing. They have to be approved through both. We have a core work group meeting on the 21st and then a public health meeting on Thursday. Typically you'd have to present at the public health meeting, but I'm running our public health meetings. So I don't mind stepping in and presenting on your behalf. The one thing I won't be able to do is answer questions, but I can take the questions down and send them to you. Because I know both of you guys are really busy. So I'm willing to do that. But I just want you guys to be aware while we review these, okay? Awesome.
Is anyone, so there's still no lead of the public healthcare sector yet?
And I got approval from Robin to approve of applications and just be our temporary lead.
Okay.
So
I mean,
just so we can push
you know
stuff.
what's going on more than most
Yeah.
of people anyway. So
Yeah. We're still working on planning a regional summit around physical activity strategies within CHIPS. So that's kind of what that group is focused on right now. Just so if anybody's interested in attending in the future, that's what we're doing. Okay, so Stephanie, I'm going to pull up your application. I'm just going to share my screen. I'm going to have you walk us through each section. So we'll start with the description. You can summarize this. Take as long as you need. We end the meeting at noon. And then at the end of, well, we still need time for the other application. I should say that. At the end of you presenting all the information, we'll ask questions, and if there's any feedback or updates we would require, we'll let you know then. Okay, awesome. My computer is very slow. Give me one moment.
I have it ready if that helps.
Either way, I have it too. I just figured it'd probably be easier for you on my screen. If it's not and you'd rather share, I totally understand.
Either way, I mean, let's see if you guys can see it. It just because I just had it sitting there. Can you all see that?
Yep, that's
Yeah.
perfect.
And
and
then
I've got it on my computer too, just so I can see it from there.
I find that making it bigger tends to help. And Angela, I see you're in a conference room. Can you see it okay? You can just do a thumbs
Yeah,
up.
I can see it just fine. I'm sorry, I had to move. My computer had an error message I've never seen before saying that my computer is underperforming and can't. I don't know if anybody's ever had that before.
Oh
mean,
gosh, I
I
hope
think
it's
my computer always does that, but
yeah. They're always like, you're running out of space. I'm like,
I guess so.
I'll erase some more emails. But well, thanks everyone for giving us this opportunity. Dr. Angela Barnett is on this plan as well. And so feel free to contribute if I've missed anything or if there's any other details. So the goal of this application is for us to implement a longitudinal physical activity curriculum in 2 core clerkships. One is in the year 4 family medicine clerkship, and then the others in the year 5 pediatric clerkship. This is an extension of.
Can I ask a quick question on that?
Yeah.
Just, is that just when those clerkships are? Like year 4 is family,
the
year
year.
5 is peds?
Yes.
Okay,
Yeah. And
that's
I
what I
kind of helped
assumed, but I didn't know if there was
yeah.
some other reason for splitting those up, but okay.
Well, it's that they'll get the first components in year 4 because they do family medicine first always. And then in year 5, where all of the core clerkships occur, they'll come back to it. And so what's great
Gotcha.
is it'll impact an entire class of students twice. So our impact would be on around 220 to 204. Well, actually more like 250 students because St. Joe students will be included.
Okay.
Yeah, and I did have a discussion about that with Maria Dicocco and their support there. I'll meet with them to kind of help streamline the schedule and stuff. Yeah. This is using that curriculum that Joey Leitner's group was funded for with Amanda Grimes and Kelsey Gardner in 2023. I was in that group, but my module was sadly underdeveloped. But as a part of it, I will develop that module along with Dr. Barnett and Dr. Dicocco. And so I'll talk a little bit about that, but it's really great and wonderful and interprofessional. They've implemented it for the nursing group. We also have talked about incorporating the sports medicine fellow in family medicine, as well as a sports medicine fellow in pediatrics. But we'll see how that unfolds and their availability at the time if this is approved. So those modules will be asynchronous learning. They are evidence-based, and family medicine already has 2 lectures that they provide in terms of engaging physical activity for health and wellness as a primary care clerkship. And this will just be an opportunity to enhance that and then make sure we're consistent across the family medicine clerkship and the peds clerkship. One additional thing is that each clerkship's agreed to reinforce sort of an extra credit assignment for students to do community engagement in a physical activity group. So that would include Just Walk, which we just presented, Walk with the Doc at the Southeast Community Center, which is my group, and then Walk with the Doc at Lakewood. We'd reinstate that group as part of this. And then we would establish a number of agencies where they can reinforce that physical activity and community engagement. So pediatrics really like the idea of Operation Breakthrough to encourage play in their gym. And then other ways to incorporate that on the health science campus, such as the Just Walks, walking with staff and faculty during those times and getting those on the calendar to engage our students, even if it's with staff. The money is dedicated to pay for 110 Fitbits. And so that financial support would be to go to those, and that will happen in family medicine. That we'll work together to give those to 110 patients as a pilot. And then the other way we will incorporate student education is to have students sit down and prescribe physical activity and then utilize apps that already occur on their smartphones. Everyone has a smartphone. And then a lot of people, 70% of Apple users have an Apple Watch. So the goal would be for students to engage some sort of physical activity prescription and then work with the patient and their family on using the app that already exists on their phones. But we would like an opportunity to provide them to a cohort of families, probably adults in the family medicine clerkship. Pediatrics was a little nervous about the adolescent and child element. And so family medicine was willing to do that. So what's wonderful is this will reach all medical students with the opportunity to have a consistent physical activity curriculum to educate their patients and to promote physical activity during patient visits. And then in those clerkships, we have patient types. So for example, you have to see a patient with chest pain. They will have, PEDS is committed to a minimum of 2 patient types in their PCC clinic to provide a physical activity prescription or goal-directed plan for a patient or their family. And then in family medicine, I hadn't quite gotten to that number yet, but we would consider at least 2 of those during that 4-week clerkship. The addition of the community engagement also will allow medical students to learn their own sort of practice in physical activity and then model that activity in the community and in service to others. So I think that makes this very unique. And I'm also tasked with creating a community engagement opportunity in these clerkships. So this aligned really well with a curriculum and an opportunity to engage a physical activity, community engagement activity.
The Fitbits part, so that's something that family would come into clinic, they'd get set up with a Fitbit, and then that'd just be something that they would track at each follow-up visit. Is that kind of how that would work with the Fitbits, or what's the
Well, in
plan
the
there?
4 weeks, it's hard to get
Yeah.
them to come back. And Angela, you can speak to this as well, is that they would engage the use of that and a plan to use it and to be engaged in physical activity. But it was hard to like communicating with patients after the visit is really difficult. And unless, Angela,
Yeah.
you say that you'd be willing to have students do that. And peds, that was really a definite stop point for children and
Hmm.
adolescents for our med students. But Angela, do you have any comments on that or engage?
Well, I kind of hadn't completely thought it through either, but, you know, I wonder if we gave the Fitbit to a patient that's willing to send a portal message,
Okay.
back, that might be something, that, and I think our students can receive portal messages. And if they can, then any student who actually wanted to engage a patient, like you said, some patients already have an Apple Watch, but then some patients don't have anything. So maybe these could be reserved for those patients that don't have anything, and they could maybe report back either their number of steps or their exercise prescription, which is currently one of their assignments anyways, but that would be a way that they could do that. And in that way, it doesn't even have to be an extra credit for that particular prescription. That would just be an activity that I would say do, basically. Because
Yep.
we still want them to go out into the community.
Well, I was wondering on that. I mean, if they have the Fitbit and you know which patients have it, then and you got whatever 20 students per 4-week clerkship, would they be
Yes.
able to kind of pass it on to the next group of students? Like everybody gets, 5. If you get it all started in July, I guess when
Uh-huh.
all the clerkships change over, that first group, everybody gets 5 patients who have Fitbits, and then they just pass that information on to the next, and people keep tracking them throughout the whole year. Would that be a way to kind of stay on top of it? I don't know.
Yeah, I think, right now, we do another program called the Home Blood Pressure Monitoring Program through a grant. And basically, we have our blood pressure cuffs, they're in the clinic, but we have them kind of secure so nobody can take them. And that's what I would want to do here, because otherwise people will take them. And then our nurse care managers help engage them. In this case, the students would get the Fitbit and take it to the patient, show them how to set it up and use it, and then have them maybe report back to them on a portal or something that's secure back. And they could do that. And I wouldn't anticipate that every single student would need one, but that I would hope that we'd only need maybe no more than a third of our patients to do that. Right now, we encourage them to do it with our Apple patients, and I probably get a few students a block that actually, do it. We teach them how to do it, and then they actually, do it. So.
So were you suggesting 5? So the students make up a team of 4 each per clerkship. So there'd be 5 Fitbits per block. And then that student of like the team of 4 students give it to the patient and then help develop the plan and monitor it.
Yeah, I mean, something like that. I mean, I don't know if 5's a good number. I don't know if 1, I don't know what the kind of
Yeah.
reasonable
Yeah, well, we have
follow
13,
through is on
we have
that, but
13 blocks, right? So I guess we could divide them amongst the blocks, there, and some blocks we have less students, like our first and second block, we have more like 6 or 8 students, and then it kind of goes up from there the rest of the year. So maybe we could, divvy them out based on our number of students. And then whatever we have left over, I guess could be used the following year.
Yeah.
Yeah,
They'll
just as
presumably
just maybe
come
a
back. Yeah.
longitudinal tracker when the students have that little bit extra time. I mean, I'm sure the nurses checking in with the patients over and over again is probably will pain in the butt, but students are kind of perfect for that.
Yeah, exactly. Well, and they actually like these sort of interventions where they cheerlead and coach, and they are applying the curriculum that we're providing. So I think they're a great group for this sort of intervention. And while the students come and go every 4 weeks, the patients should be selected on those that, are already getting continuity and they show up, every 6 months or every year. So if we give it to that one patient, it will certainly be able to go back to their clinic and say, hey, I actually have kept up with this, or I haven't been able to keep up. This hasn't been a big motivator for me, but it's just a nice intervention for those that don't have it. So I polled my last walking group with the AARP, and of 19 people, 17 had Apple Watches or Fitbits. The 2 that were left over were getting one for Christmas, and the other one it broke. And so it's fairly prevalent even in that age group. And so I do think the Fitbits, while we're trying to give them something to motivate them, I do think students can work with those that already have apps and already have their watches, which is what PEDS wants to do. PEDS just wants to encourage them to pick an app, and that it will have some way to remind them, and then ways that, like, what do you like to do? Can we just implement walking 3 times a week? And so setting up those goals, they were more encouraged by just encouraging family members to download an app and work as a work with the kids. So I do think this will stretch more than just the 110 Fitbits. But and that is the core amount of the money. So so I feel this really supports both healthcare and public health strategies. Was there anything else on that kind of process and protocol? Okay. So this will reach all medical students at UMKC on the Kansas City and St. Joe campus in their family medicine clerkship and pediatrics clerkship. So I do think that it reaches a lot of healthcare providers and future physicians, and how they could incorporate this, not just for their patients, but kind of for themselves as well. So making this a normal practice to assess and discuss physical activity every routine encounter, and then document that, integrating it into routine patient encounters, and then encourage health professionals to be role models. And so that's the part connecting them to the community. Is that sort of unique, is that we ask them as extra credit to do one physical activity, community engagement activity. And I have 8 right now, but I will be working to make sure there are at least 12 and at both campuses for students to engage others. It's also important for students to recognize this in themselves. I do have a current research project where we show increased burnout for those that are not physically active. And so we've got an upcoming study to encourage physical activity. It would have been great to submit here. I just don't have it ready yet. But what's wonderful about this is once you curricularize physical activity, it becomes part of who they become. And not only is it happening in one clerkship, which already does a wonderful job at it, it's happening in 2. And so I think that really helps support a lot of these strategies. It falls into the universities and postgraduate programs. And then I did highlight a few things that I think specifically in the tactics that we will accomplish by having these walk with a doc and just walk activities, and that community engagements. We're encouraging networks and opportunities for equal fitness access. Everyone has a smartphone these days. And then specifically with a cohort to provide the Fitbit. Reducing financial barriers. The AARP and Walk with a Doc does provide a grouper sort of endorsement. And a lot of times your insurance carrier will reimburse you for walking. And so I had the AARP of my regular 19 members, only 7 found that their Medicare or private insurance would reimburse them. I threw mine in. I do not get reimbursed for walking, sadly. And so Blue Cross Blue Shield does not participate, but we can provide this as an opportunity to have lower costs. And then for pediatrics, they have school-based clinics at Operation Breakthrough, which are changing, but we have a relationship with them where our students, they love our students. They've got great background checks and a lot of skills that we're going to create that as an agency where medical students on the peds clerkship and even possibly family medicine can go and provide support in the gym and in supporting play or whatever sporting activity they'd like to do as part of community engagement for that school age group. So the public health element is using the existing tools of physical apps and providing Fitbits to some or on smartphones and other wearables that people have. We are supporting that teaching module that was already supported. We're going to advance that and work to create a kind of an information hub of public practices, tools, and resources. I'm hoping, with this work group that we come up with sort of a stepwise prescription for physical activity for both of these clerkships. So students sort of know best practices or how to do so. And then the community engagement and physical promoting practices, I think, is unique to this, and around sports recreation, and then our walk with a doc. Michelle in the family medicine group actually suggested that we partner with Boys and Girl Scouts of America. The only trouble is they only meet during school. And so it's pretty much just an August to May thing, but we'll work on more community engagement activities or agencies that support physical activity. Girls on the Run does happen in June, July, and August at Children's Mercy. So that could certainly during those 3 months be an activity for students on the clerkship. It's just we needed activities that are available all the time. So we will engage more physical activity groups for school age kids to encourage physical activity. And then
I wonder if could the students be I mean, it's only, well, I guess it happens more than once in the summer now. Win for KC, like going and being coaches or something there.
Okay.
Would that be a place they could help? Because I know they're always looking for more people helping with that.
And Football KC helps support refugee families, and they have sporting events every weekend. And so those I can put into a calendar as opportunities. So we just need to know about them, and happy to set a relationship with that agency to help support this way.
Yeah, they've got it's all over the summer, so that would take place outside the school year part. Quick question on that, on the public health part, is there a specific strategy named there? They always
yes, disseminate tools and
is
resources.
it like strategy 37 or something? I don't know. Just I mean, we can look it up.
I think I may have gone just straight to tactics.
Okay.
So but I can add that. Here, let me make a note. And I think that's maybe just didn't include the number. Is disseminate tools and resources important to
I assume that was a number. I just didn't know what it was off the top of my head. But.
Gotcha. Sorry about that. So, and then I just included the system level that it addresses. And then I just did something
really quick. So Stephanie, Tracy had asked, we were messaging. So I don't think it went to the entire group, but she had asked if you thought about 4-H.
Yeah,
okay.
Yeah, I'm sorry. I'm sorry. I didn't want to interrupt you. But
No.
yeah, we have a very healthy and active 4-H program in and around Kansas City in the urban region, as well as some of our outlying Platte and Clay outlying urban regions as well. And it's all year round. So you might want to think about that.
Yeah. Well, and that'll be really helpful for St. Joe as well, because they're much more rural community.
Yes.
Yeah, I love that. Great. Especially my dad was raised around 4-H, and so I completely love that.
Yeah. Yes.
Kind of wish I was. So great. And please keep the ideas coming, because that'll just enrich what we offer for students and their engagement with patients.
Oh yeah, absolutely. And as you're going through, I'm so late to the game, so I'm trying to catch up. But as you guys are talking, I think that there are a lot of let me just take a minute to introduce myself. Even though you can't see my face, I'm Tracy Graybill, and I am the community health field specialist here in the urban west region of Clay, Platte, and Jackson County. I'm with MU Extension in the community engagement and outreach office. And I've identified obesity as a major health priority to address here. So that's what I'm doing here.
That is
you-
perfect.
Yeah.
Yes,
Yes. So anyway,
absolutely. Thank you. And you said
Thanks
you
for
also
doing-
contributed to IPE, and this is very interprofessional.
I did. I did. I worked for the School of Nursing, Stephanie. I remember your face and your name. Because I had IPE projects that I was coordinating over the School of Nursing with Margaret Bromelsek and Carol Schmer and all of those people. And I never missed an IPE event if I
Oh,
could.
thank you. Yes, and Carol's still involved. Yeah, and we've redesigned the first activity, so it's on March 14th. Yeah. So,
Awesome.
yeah, it's still growing.
Yeah.
Keep it growing. Well, thank you for all of your contributions. I appreciate that so much.
No problem.
Yeah. So I deleted something on this, but I really felt like on the system level, it hit all of these. And just sort of like we've had biking stuff in the past, and this would support that if it's regionally appropriate. And then walkability efforts because of our connection with Walk with a Doc and expanding that as part of the project. I did combine the sectors. Education I considered, but I didn't see a sector leader, so I thought it best to combine these two. But if you say money is short, that would be another opportunity. It just wasn't touching school age kids regularly. It was touching more graduate students, and in our medical students. But I could certainly look at that if you needed me to. And then, oh, sorry. Yeah, Katie.
Yeah, no, I don't know if I responded via email to you or if it was just Jay. If you were to ask for funding from our school sector, it would need to align with their strategies and tactics, and I don't believe this project does. So I will just tell you in advance, and you do
Yeah.
make a good point. Yeah, it doesn't align with what they're focused on.
Yeah,
Yeah,
and
because
that's
they're
what
really the grade school, high school stuff.
Yeah.
So
Well, and originally we were going to try to implement the Let's Play curriculum and partner with schools. It is such an uphill climb. We've talked about it for a long time. When I talked to Emily Goodwin, who was interested, she's like, this is a lot. And that curriculum wasn't as useful in their clerkship as Joey and our previous curriculum. So there was a much better hit for them to implement and actually make this an assignment in PEDS. So the Let's Play was, I mean, it'd be nice to teach high schoolers to provide before and after school care, but with COVID, it has changed. It's not before and after school. It's usually during school, which our students are not available for. So,
Yeah.
Okay. So next steps, it's nice because the previous speaker is part of the ACLM and he's the only ACLM certified physician for like, I think he said 50 miles in Springfield. But ACLM, we are about to apply for a certificate and we've reached bronze level, which means we have a lot of room to move. But they provide some assistance once you join. And we have at least 2 ACLM certified faculty members who are interested in helping apply for a grant on this. And so they have others that find grant funding and help you write grants once we become part of ACLM. So that would be the goal, is to look for funding for more of this. It's sustainable because we're curricularizing it. It's just the Fitbit piece and the funding for that would not continue after this funding is there. However, we would implement the curriculum and it would stay, and it would also have that great community engagement element. We will promote it locally to UMKC departments, health professional schools. So as we mentioned, I'm very interprofessional. So our PA program's interested in this. I just didn't get a chance to include them, but I do know we can work with them on their curriculum. It's much shorter. It's 22 months, and find ways to have our PAs as well as graduate nursing students and nurse practitioners to implement it, which they already have. They've done Joey's modules already. And we could also present to the AAMC or Central Group on Educational Affairs just to disseminate UMKC's work in this area. And that would be the plan for students to present this as research either at a quality improvement, patient safety, or the Health Science Summit, and then take it further regionally with Central Group on Educational Affairs or the AAMC. And they have small scholarship programs as well at those sites, so we could look at funding and work groups while we're at that conference.
Yeah, so just the last time we did some proposals at the core work group meeting, one of the big things that everybody was questioning on these is really what is our goal with these proposals, and it's to get something started. So the fact that you've got plans to keep it going financially after this initial part, I think is huge, because that was one of the things that Robin was bringing up, is that we don't want to make it so that the KCPA plan just keeps funding this. It's like a one-time start it up and keep going. So I think that's really important, to have some plans to just keep it going. So.
And our dean is very interested in wearables and physical activity. And so he said, are you the person that could kind of discuss this? I said, oh, I already have a project with students in burnout and physical activity, but as part of the KCPA program, there are a number of engaged people. And he said, we should look at funding streams. So he's already interested. He just didn't get back to me on what he was thinking. Like Garmin might fund this because Garmin's sort of a dying beast, but they might be really excited to give out a bunch. And then I've also heard Fitbit was bought out by Google. There might be some changes there, but
Yeah,
they might be really excited I mean, I don't love vendors that fund this. I'd rather go with a grant, but they might really be excited about a project for us to get the data on functionality and stuff. And if gave them to all medical students or something. So more to come on that. I just didn't have real specifics, but he said, I think we should work with engineering and we should do a bunch of other things. So more to come. He's definitely supportive of this in our curriculum though. Yeah.
awesome.
Yeah. So this is potentially a first step for a larger program, for a large scale exercise medicine program in Kansas City. Taking it to Central Group on Educational Affairs, that's a really wonderful group about implementation. And so we could easily make it a multi-site in terms of medical school environment to consider that. But these are 2 primary care key clerkships that we have for students. Family medicine's already has some wonderful stuff for the students and has always reinforced physical activity in their clerkship. And so Angela's been wonderful to work with on ways to enhance that and then implement it and hopefully get something that we fund and continue to fund for sustainability. I do like that sort of coexisting lifestyle medicine choice too, is that in the background, we are reinforcing medical students foster their own physical activity in their professional development and in their future practice in medicine. So not just that they tell patients to do it, but they themselves understand the importance. And so that will kind of be not a hidden agenda or hidden curriculum, but that students should practice kind of what they preach in lifestyle medicine and through physical activity pillar. And then there are opportunities. So the Health Equity Institute has community clinics, and that's where Walk with the Doc on UMKC campus was birthed. They pay for it. And so there are opportunities for students to actually go into community clinics and talk about developing independent, like exercise physical activity plans as community engagement. So that might be another thing I can assist with as well. Yeah, Katie, you had a question.
More so, I just want to give you a warning on time. We still have to review one more application.
Yeah.
Okay.
The nuts and bolts of the budget, I combined, not all of it. It's some of it. And I'm just going to take off education on your recommendations. Do you agree?
Yeah.
Okay. And 8,800. So it's 100. It's like $80 per Fitbit. We talked about the Fitbit charge, which is anywhere from 100 to 120. I didn't have a chance to investigate like discounts for large like orders and stuff. So I can certainly do that to try to make our money go. And so there's
Or if Google will give you a bunch.
well, right. Like I'm happy to investigate it because I did a lot of I did a deep dive. I went down a rabbit hole, but I'm like, wow, is Fitbit going to be around in 2 or 3 years? And it will. But so, and then there are also decent app memberships, which give you feedback too. So I'll work with the clerkship directors, and Angela's got some really great ideas on what we think would work for that, but they all range anywhere from like $50 to 110. So I just landed on the 80 just as a proposal. The Walk with the Doc subscription to, we already have it at UMKC. I pay for it, but we would pay for it for Lakewood to re-engineer and reinstate Meg Gibson's Walk with the Doc. And then I did want some faculty support. There's a number of faculty who run the clerkship. And it's not a lot, but it at least gives them some support to help develop the curriculum and then implement it. And then it will be curriculized and stay there both in family medicine and peds. So that's that $3,000 amount. It's $500 per faculty, 3 at each site.
Okay. All right. Yeah. Do we want to talk about the point system right now, or just bring that up to the core work group? Katie, what do you think?
The point system is really just for the core work group, so it has to have pass
mean,
with a 7 or more to be funded. I think what we need to decide is how much we're willing to fund.
Right.
But again, we have 2 applications, so this isn't something we're going to be able to talk about unless both of them pass the core work group meeting, and then we'll reach out.
Okay.
Okay.
right.
I know we only have 15 minutes, and I want to get through this other application.
Yeah.
I don't know more if you guys can stand a little longer, so we make sure we get through it. Stephanie, Dr. Grimes has worked with Fitbit in the past, using wearables, and knows a contact she did for a discount, bulk price. And then Dr. Jordan Carlson with Children's Mercy specializes in wearables. I'm trying to find his website because you can reach out, and I think he works with Garmin and he can get a discount. So just 2 names really quick. I know that specialize in wearables who have contacts at both organizations who have done bulk orders for discounts.
Excellent. I got Jordan Carlson and I know of him. What's the other one?
Dr. Grimes, Amanda.
Okay. Oh yeah.
who has
Yeah.
the
Gotcha.
curriculum. Yeah.
Thank you.
And Joey would probably know too. I just know she's the one who worked with them when we ordered devices for our Move More, Get More study.
Awesome. Thank you. I reached out to Mallory Moon because she had our Healthy Kansas City site funding. Well, actually I reached out to Shelly and said, can I get in touch with her? But I didn't get very far with that. But I'm happy to build whatever's going to work the best and make the best use of the money. Yeah.
Perfect. Well, I think our next thing is just as a group, we kind of discuss whether or not we think this fits with our tactics and strategies, and if we're cool with passing it along to the core work group. In the past, I've usually just gone with thumbs up. There's no longer reaction, but you can in the chat. Because Tracy, I know your screen's not on, but if we all agree to pass it through the core work group for a final review for funding, just give a thumbs up. Unless you have any questions or concerns.
Do I get a vote?
Jay,
Yeah, you can vote.
yeah, you can vote. Tracy, Angela, do you agree?
I agree.
Perfect.
Okay, gotcha.
Yeah, we can see it. I assume
Okay.
that was a thumbs up.
Yeah. So we will bring that to the core work group meeting on the 21st, where Jay will present on your behalf, and then we'll follow up and let you know what they say.
Great.
Okay.
Perfect.
Yeah, absolutely. I know we're down to
All right.
13 minutes.
Yeah.
Angela, it is your turn.
Okay.
And I can stay on later. I don't know if everybody else can, but we'll get through this.
Okay.
Okay. I will bring it up for you.
Thank you, because I'm in a conference room and can't do that now.
Yeah, that's okay. I've got it ready.
Yeah, and so mine's kind of coming from just a slightly different angle than Stephanie's, but we're planning on overlapping each other a little bit. The one I'm proposing really started out at the resident level, and basically we have an area of concentration in integrative medicine and lifestyle medicine, and this was to help support them pay for their curriculum, which is pretty expensive. But I also was going to have them as well review the online physical activity curriculum developed by Dr. Leitner as well. And part of the thinking behind that is that I would ask them if they received a scholarship from what we proposed, that they have to help review the module that Stephanie's planning on working on, and see if we can pull any of the integrative medicine lifestyle curriculum into that module, if it's appropriate, or if it adds something, or if it's, or maybe there's a better way of doing or saying that might add some value. So that was one of the things I will ask them to do, if we're funded, for that. And then the other thing besides just that, the educational part, what we're planning on working on is developing a dot phrase that's used in the electronic health record. And this could be part of a bigger project, Stephanie, like you were talking about. Like, I just got accepted to the QUIP scholarship program this year, and I have the right to work with 2 students and a resident. And this could be the project that I do. I had a different one, but I'm kind of down the pipe with it anyways. We could certainly try to embrace, increasing lifestyle medicine and physical activity into the electronic health record with a prescription under goals, which is part of what we're all trying to do in the electronic health record. And I think it would be really cool to be able to use these wearables, to do that process. And so what I have found really helpful is it's really great when I'm doing stuff, but it's more great when all the faculty and the residents are doing stuff. And so this is part of getting my group of residents to get their other residents involved in doing this very same thing. And so the idea would be that there's a lifestyle assessment that the patient fills out, or the students can take when they're seeing a patient. That's one of their current assignments, is to do a lifestyle assessment, and they can divide it up. It doesn't have to be the whole thing on one patient, but it can be different parts at different times. And basically to make a prescription. They have a mind-body prescription, they have a physical activity prescription, and they have a nutritional prescription that I asked them to do. And so this is going to be a more formalized activity to add to Stephanie's curriculum so that it's got more teeth in it, I think. And then the other thing that I've asked the residents to do is to plan a project that's a kind of a health fair or workshop called How to Stay Well for the Holidays, and it'll be next fall. And the idea behind that is that we're going to try to partner with Jackson County Health Department, and we can partner with other people too. And the idea would be to have stations that address the lifestyle pillars that help support your immune system during stress and during the holidays, basically. And so that's what part of the funding is for as well. And then the other last little thing we've asked this group of residents to do, if they receive any scholarship money, is I want them to partner with the students to do Walk with the Doc and their sports medicine fellows, and kind of make it residents, fellows, maybe faculty too, and students together, so that we're just kind of creating a group that is mentoring each other, basically, in doing this community work. So that's kind of what the overall whole project is. And so if you look at my strategies, basically it kind of shows those things under each strategy and tactic. So do you think I covered most of it, Katie?
Yeah, I do. I was trying to
Yeah.
keep track with you based on the strategies, and I thought you were going through those specifically.
Okay.
So I think you did great.
Okay.
Yeah.
I just kind of did them more in general, just to so everybody can look at that too. So and I think our goal also is to keep this going in the future. So it'd be this, the residents won't receive all of the scholarship money. It'll be they have to do something to receive scholarship money, basically. And we requested some money for the health fair as well. Now, we also might be able to get some community people to do stuff without paying them as well. We just haven't walked down the path of doing that to see if that could be cut out of the budget as well. So that might be a place that we could reduce the budget so that both projects can be funded.
Yeah. So that University of Arizona Integrative Medicine curriculum being $6,000, is that once you buy it, you can have as many people work through it, or is it only for 10 people or 100 people?
They kind of changed it. It used to be that way. And now it's basically $1,000 per resident for 3 years, basically. And my goal was not to give the whole $1,000. It's to give the residents $250 for everything they participate in. So if they participate in the health fair and they have to do something for that, that might give them a $250 scholarship. And also if they, like, if a resident wants to help organize Walk with the Doc for the entire year, they might get $250 for that as a part of their scholarship. So it's not to pay the whole amount, but that way it would be ongoing over time. And then we need to find other ways for our department to help keep that going. And it would
Okay,
be,
so
I
the
think,
$6,000 would be the scholarship for the resident to get
Yes.
the integrative
Yes.
medicine curriculum.
Right.
Gotcha. Okay.
Right. Yes. And they would have to do something for that too. You know, not just, they don't just get it because they want to do the curriculum. They have to do something.
ACLM does have a really wonderful lifestyle medicine. I'm not sure it's as integrative as maybe what you need, but a lot of their items are for free. And
Right.
Jennifer Trolk's been very generous about that, as well as who was
Yeah.
speaker, Jay and Katie, at the last KCPA in-person meeting? The one who did the
Oh,
preschool aged intervention.
yeah. She's over
willing
at
to share.
KU.
Yeah, she's willing to share as well, just as a thought, because
Mhm.
Okay. Yeah, the
Yeah.
ACLM, I mean, yeah, that'd be a much cheaper version.
yeah,
But I can't remember.
it's more of a
I
med
feel like
school
that is
type
more,
Yeah,
I don't know if it's as resident
it's not. That's a good.
based.
Yeah,
Because you're looking
There's-
at both residents and students on this.
Yeah.
Yeah.
Yeah. Well, my residents are going to interact with the students. So, you know, students who, they have an assignment to do lifestyle assessment, but now we can actually put it into the EHR. So that'll be part of their note.
Nice.
And then we can, you know, use the Fitbits for the physical activity part, basically.
that's
And that,
amazing.
like I said, that could be turned into a big, huge Quip Scholar project. If you want, Stephanie, we can talk about it.
Happy to, because I know students would
I'd
be
be
great
fine
for
to try
you.
to do something like that, so.
Yeah. And then also we have a UMKC Health and Wellness Fair that is going to be in its 4th year, and it's in the summer. And so when you do your healthy eating for the holidays,
Mhm.
happy to have that same student group, which has an entire board and some faculty support, help you with planning. So you don't have
Okay.
to do the uphill climb. Like you can duplicate it. We have like 33 stations. Jay's been involved and done pre-participation physicals. So that work group would probably be enthusiastic about trying to help you plan that. And then talk about like what lessons learned from advertising and PR and things like that.
Mhm. Okay,
And then I also know of a local kombucha press juice vendor that donated for our university health fundraiser this year.
okay,
Probably at that they would just share services just to get some free like.
sure, yeah. It's very possible that, yeah, we could get people to do stuff, hoping that would increase their, you know, their business.
Yeah,
Yeah.
for sure. And so I could ask Emily who that was, because I remember stopping at the station. I was like, supporting local business. So
Okay. Any more questions for me? I didn't go through
Yeah.
mine in as detail as Stephanie did, but.
No worries. You know, and I'm wondering if, you know, for funding and stuff, if there is a way to combine these two projects into one.
I
I
feel like the
feel like there's a lot of overlap, but you're obviously in charge of them each. I didn't know if that would be a way to spread it across the public health and healthcare sectors easier. I don't know.
I would be open to that, Angela, because
Yeah.
when you implement things for residents, students always benefit.
Right,
And I do love the idea of not just the pillar of lifestyle medicine, but you're talking about integrative medicine. And so whatever student involvement we could do within the clerkship, I'd be happy to combine if you think that would be
Mhm.
helpful.
I feel that way too. I think it'd be fine.
Yeah, but
I
I
will-
mean, if the med school stuff and the residency stuff has to stay separate for funding too, then that,
Yeah,
I
I
mean,
think
that's
only
just
the,
a thing.
only that amount that I asked for the residents could be separate, but the rest of it could be combined, I think, totally. Just because their curriculum is a little bit different.
Yeah, and I
And-
mean the whole eating well for the holidays, being well for the
It's-
holidays, how to
yeah,
stay
stay
well for the
healthy.
holidays. Sorry, I see
Yes,
it now.
stay healthy. Yeah.
You know, I mean, that would be something that would be kind of that extra credit for those students too to help work on
Uh-huh.
that. I mean, that'd
Yeah.
be definitely one of the projects that I would think would count. I mean, you get to decide, Stephanie, but
So my question, you guys, I think the combining is a great idea, especially to distribute these funds appropriately and make them spread out. My thing though is that if we do that, we'll have to write a new application. It doesn't need to necessarily be reviewed in this sector, but definitely still the public health sector. So I'm not sure if that's enough time to finalize a new revised version by Thursday.
Mhm.
Yes. So just keep that in mind. And then my other thing is based off what Stephanie had advised with free resources for residents. Would that change potentially your application, Angela? Would you want to look into that, or do you still want to do the 6,000 for?
So the idea is that our residents get certified in integrative medicine, and right now we have not really gone down the financial path of making lifestyle medicine an area of concentration where they receive a certificate. And that is something that could happen in the future. It's just that there's quite a number of steps to jump through, and there's funding that's required for that as well at the resident level. And my department has not committed to doing that, whereas they've committed to allowing this, I guess. So I think I would, and if we needed to reduce the amount that we put for that little resident part, I think that's fine. I was just trying to get that going a little bit, basically.
and yeah,
Okay.
and again, that kind of what I was talking about on Stephanie's plan. So the kind of concrete plan to continue it after this initial round of funding, would you think that'd be like doing it and then convincing the school of medicine to keep paying for it? Would that be the most likely step forward for funding, or would there be another route for continued like years in the future funding?
For the residents, you mean?
Yeah, for
Yeah,
that.
I actually have written several grants over the years, and my goal is to, I would hope that actually even the charitable foundation might find value if we were to have a event every year. And that maybe they might help, to help us to provide scholarships for residents wanting to do this in the future. Other academic institutions pay these fees 100% for the residents. Our academic institution does not. I think we all understand that. And so it's just always, trying to find where there's some funding to inspire people to do things that are more than what they're required to do in residency, basically.
Yeah. Okay. Yeah, because that's the one that everybody keeps asking, like, how do we keep this going? If this works
Yeah.
great, one-time thing, how do we keep it going without just
Yeah.
KCPA
Right.
funding?
I
So-
agree.
So I think if I'm hearing you right, Jay, that would be something that would need updated on the application is a more solidified plan on how your next steps would be to continue funding
Yeah.
that portion.
Yeah, it's
Um,
just
and
it's one of those
I'm just trying to
because
relay what
it's worth
everyone's.
two, 1 or 0 points on there, and so that can kind of make or break it. I've just seen a few of them over time where that's a
Yeah,
big
no,
question.
Yeah.
I just want to make sure everyone's clear on where each of these proposals lie. So if we're going to combine portions of both, then I think that maybe it might be wise to wait to bring it to the core work group for another month. if you guys want to work together to see about combining. If these are still going to be separate, then there's updates to one. I just want to know and make sure I'm understanding where we're all at. So if Stephanie, if you and Angela want to discuss a little more about how to work together,
I think so.
that's fine.
because-
There's no rush.
Yeah, that'll give me time to talk to Jordan and Amanda, and if I can get them to do a bulk pricing and I can bring my amount down, I do feel like Angela will get much needed funding to help support additional certification for her residents, because
Yeah.
all of our residents are doing that. And we have a fellowship, but everyone's applying for it. So I do think that sustainable element that she'll have in just jump starting this would be better use of the money. And I can work on, seeing if I can get better bulk pricing and not put it all into Fitbits for a few. Yeah, so Angela, I'd be happy to work with you on that. And then I think we could combine a little of what med students would get in the clerkship as a result of the residents getting this. You already
Right.
talked about combining them, and we can make that a very clear sort of opportunity for community engagement or curriculum development and things like that for students on the clerkship. So
Mhm.
is that we're not missing a deadline if we do that and bring it to the core work group in a month?
Yeah, no, so I'll still have to review it for a public health meeting, but I
Okay.
can wait until February. That's okay, because it'll happen before the core work group meeting. If we want to get together as a sector to review it one more time and ask questions, or not even as a sector, we could just do this small group. That's totally fine. Or if you
Okay.
guys want to come to the public health sector meeting and do it there,
Yeah.
that would
Right.
be even better.
Yeah.
Right.
So
And am
I'll-
I hearing that we think that it's better for us to combine than to leave them separate? Is that what you kind of think?
I mean, I
I-
don't think it really matters. I just thought
Okay.
it was kind of a convenient way to just
Yeah.
put all the funding together in one
Okay.
big.
Yeah, and I think that you'll have a better chance of the entire thing being funded if it is combined within certain elements. Just because the core work group, not everybody is, a lot of these individuals also come from like community organizations who deal with like one-off programming. And so there's different mindsets. So kind of putting it into a format that they believe is reasonable, that aligns with the KCPA plan, that would probably benefit you most within the scoring system. I guess that's where my mind's at.
Okay.
So
Yeah, and
You can
we
keep them
also
separate.
have to send it to our council on curriculum because it's an intervention in the clerkships. But if
Mhm.
there's not assessment involved, it's not a problem. Both pediatric clerkship and family medicine clerkship director, which Angela is, are in favor of doing this anyway. And so,
yeah.
so it would give me some time to make sure and run it through them. It's not a grant. It doesn't have to get presented to the council on curriculum. It's small enough because the intervention's not, every student has to do this. We're just supplementing the curriculum they have in a way that they wanted to anyway. And the service learning I'm required to do. So that's just a bonus for KCPA, but it is a really good way to coordinate between two clerkships. So I think a little bit more time, Angela, I'm totally open to that because
Okay.
I can see about funding the Fitbits, or maybe we just don't do that and we just do app.
Uh-huh.
Because you've
Right,
already got
okay.
that in your curriculum and students would just
Yeah.
get sort of script
Right.
and we implement it. And I think this will be exciting either way.
Okay.
And
Yeah. I think
I'm
so.
not saying you can't have two applications and one is just specifically for those resident stipends. Just rewriting it to state that specifically and putting the other ask amount into Stephanie's. Like two is still okay, depending on what you both decide.
Cool.
But this gives you one more month.
Okay.
So, yeah, okay.
Awesome.
Okay.
Good deal. I'm excited about yours too. That's
Yeah,
great. And
that's-
at the same time, it's your Quips project.
Yeah, it could be, absolutely.
Yep.
Well, it's nice that the residents get a certification too. I mean,
Uh-huh.
that helps with all sorts of stuff.
It sure
Yeah.
does.
Cool.
Well,
All right. Well, I think those were the big things. We got future meetings planned. I think we're skipping the February one for healthcare,
well, so
or was that curriculum?
we,
I forget.
so curriculum will be in February. Oh, but yes, we're skipping the curriculum meeting because it is active living conference. So, oh no, it's not. Which one is it? Oh, we have so many meetings coming up. It's Win for KC.
Oh, that's what it is. Yeah,
Yes.
the
So
banquet thing.
yeah, in mine, I know that a lot of our associates plan to be attending, and my entire team is, so that we can't host a meeting. We don't have the support system for it. But we will have another healthcare meeting that'll be in March. However, I think that maybe, like I said, instead of waiting till March for this application, we do it
Yeah.
at the public health meeting because we've already approved this through the healthcare. So I'll follow up with you, Stephanie and Angela and Jay, so you guys are aware when that happens. And
Yeah.
if we have to set it for a different,
Mhm.
just because the meeting is on a certain day doesn't mean we can't change it.
Yeah.
I haven't sent out registration links or anything yet for February's public health meeting. So I'll talk with you guys.
And
Okay.
is that the one you
Uh,
said that's on Thursday?
There is one Thursday, but that's not enough notice. And I was
Okay.
only gonna host that meeting
Okay.
because of these applications, but nobody's actually registered. And I don't have an agenda. So I might
Okay.
be rescheduling that meeting.
Okay.
Yeah, I do want to say one thing. I want to do one more update, and that is for those who don't know, I think this could be applicable to this group. The Active Living Conference is coming up, and that is, I believe it's March 16th. Is when it starts. It might be 18th. No, it is 16th. For anybody who's interested in registering, there are early bird specials. I just think it's a good opportunity for networking and kind of, yeah, that stuff. Okay, I know we're 10 over and I don't want to waste anybody else's time, but thank you for joining us. I'll follow up with everybody and have a good rest of your day.
Thank you.
Thanks, everyone. I'll get with Angela on a meeting soon.
Okay, sounds good. Okay, bye.
Thanks all.
Bye.
Bye.